Hi, my name is Betsy White. I'm an assistant professor at Brown University in the School of Public Health, and I'm a co-investigator on the Long-Term Care Data Cooperative. This brief video is just meant to give you a little bit of information about how researchers can access the data cooperative data. So there's 4 approved data uses for the data that are available through the Long-Term Care Data Cooperative. One is population health analytics to support operations and care coordination for the long-term care providers who share their data and are participants in the data cooperative. And this essentially means that we share their data back with them in a way that helps to inform their organizational decision making and helps them to understand about their population and to see things that they may not be able to see on their end. Public health surveillance is another use of the data, and this is where we work with public health entities to support important epidemiological questions, to do things like assess COVID or other emerging diseases, and so this is a really important data resource to track some of those things. And then there's 2 approved data uses for research, and those are the 2 on the right here. So one is observational comparative effectiveness research, and then the other approved data use is clinical research studies, including randomized trials. So I'm going to say a little bit more about each of these. So when we're talking about observational comparative effectiveness research, what does that mean? So generally, these are going to be cross-sectional or longitudinal analyses that where patients or residents are exposed to some sort of a treatment or an exposure, as opposed to just being, kind of a descriptive trend study over time. There's some sort of a treatment or exposure. So the study is proposing to compare patients who were or were not exposed to a particular drug, a test, a care regimen, a care model, or they were exposed to different treatments intended to address the same clinical condition. The other approved use would be for clinical research studies, which includes, and these are interventional studies, so both randomized control trials or also pragmatic trials. And the Long-Term Care Data Cooperative is housed under the NIA Impact Collaboratory, which is specifically designed to support pragmatic research in nursing homes. So this is meant to be a key data resource to support pragmatic trials as well. So just to give a few examples of types of studies that would or would not be approved under those data uses. So one would be looking at incident hypoglycemia in residents with or without sliding scale insulin. So here the exposure would be sliding scale insulin, and that would be a perfectly acceptable use. And that would be different from an example that wouldn't be approved would be looking at like adherence to diabetic clinical practice guidelines in nursing homes. So that has more of kind of a compliance or a that's more of like a trend study over time. There's not a treatment or exposure there. So that would not be an approved use. Another example of an approved study looking at the effectiveness of a staff dementia education intervention on agitated behaviors and ADL decline in residents with dementia. That would be perfectly acceptable. That would probably be done as a pragmatic trial. Something that would not be approved would be again, just kind of looking at descriptive trends over time and antipsychotic prescribing for for-profit and nonprofit nursing homes, kind of like a structural facility level characteristic. That's something, that could be done in outside data sources, and it's lacking that treatment or exposure. Now, it would be perfectly acceptable to look at trends in antipsychotic prescribing as an outcome of a trial where the intervention is a staff dementia education intervention. That would be perfectly acceptable. But again, these kind of like descriptive trend studies, just looking at like structural facility characteristics, those are the kinds of things that would not be approved. A final example here of an approved study looking at adverse events following Paxlovid treatment in nursing home residents with COVID. So here, your sample would be nursing home residents who have COVID, and then the exposure would be Paxlovid treatment. that would be perfectly acceptable. A contrast to that would not be approved would be, again, just looking at like facility level factors associated with COVID testing frequency. Again, it's lacking that treatment, that exposure, and that could also be done in other publicly available data. So hopefully those examples just give a little bit more clarity around what kinds of studies are in line with the mission of Long-Term Care Data Cooperative, but also please feel free to reach out with questions, or as you have research questions that you're thinking about and you just want some input, we're happy to provide a little bit of feedback. So there's two options through which people can access the data. So you can request to either use the EHR data alone, and if that's what you're looking to do, then we have a designated virtual secure workspace through which you would access the EHR data. Or you can request to access the EHR data linked to CMS data, to claims data. And in that event, you would access the data through the NIA Data Linkage program and through their enclave, their virtual secure workspace. Now, we're in the process of overhauling the workspace where current users access the EHR data alone. So over the next couple of months, the two workspaces that you would be accessing for the EHR data alone or EHR data linked to claims are going to be very similar. It's just one you'll have the claims data, one you wouldn't. But we're in the process of doing that right now. So to say a little bit more about the linkage program, and we do have, if you check our website, we have an upcoming webinar specifically about, or with the Acumen team from Linkage, with a little bit more detail on that. But just to say a little bit more about the NIA Data Linkage program. So this is a very valuable resource that NIA has invested in to make NIA-funded studies available with linkage to CMS data. So the Long-Term Care Data Cooperative is one of those NIA-funded studies. There's also the Health and Retirement Study is there, the National Dementia Workforce Study. There's lots of other studies that are available for linkage to claims, and I would encourage you to check out the linkage website here at the bottom for that information. But so basically what happens if you want to access the EHR data linked to claims, you apply to the Long-Term Care Data Cooperative, you go through our application process. Once you are approved to use the EHR data, you would then complete the linkage DUA process, the linkage data use agreement process, and we would help you to facilitate that. And then once you've gone through those two processes, you will have access to the EHR data matched to claims via the linkage enclave. And on the right here, we have this is from the linkage website. These are the CMS files that are currently available via linkage. We have the match rate of the EHR data to the CMS data on our website for residents age 65 and up. The match rate is 99% of the EHR data to CMS data. So high match rate. So really a lot of opportunity within these linked data to ask a number of important questions. So briefly, what are the costs to use the data? So if you are conducting an observational study, by and large, most observational studies are going to have no cost to use the data for standard access. And this is either for EHR data alone or the EHR data linked with claims on the linkage website. So standard access is pretty much what most observational studies are going to need, unless you're coming in with something where for some reason you're going to need a lot of additional programming requests on our data engineering firm that would go above and beyond what a typical user would need, or if for some reason you need a lot more storage space on the environment than what a typical user would need. Those things might results in some additional costs, but by and large, most observational studies will have no data costs to users. And we do on our website have a document that specifically spells out what's included in that standard access. But observational studies, for the most part, free to use the data. Now, interventional studies will have some additional costs just because there's more programming demand on our data engineering firm, both to cut the cohort. Oftentimes interventional studies need more frequent cuts of the data. So interventional studies and again, observational studies that for some reason have excessive data needs may incur additional costs or will incur additional costs, and we would encourage you just to reach out to the email here on the page. We're happy to provide more information on that. You do not have to have funding to access the data. If you're looking to use the data for pilot funding and you're just, you don't actually have to have a grant to use the data. But we do ask if you are funded and you're funded by a source other than a federally funded award or just kind of internal institutional funding, just reach out to us just to provide a little bit more information and on that. So again, we have our website, lots of information on that. I encourage everyone to take a look at that, and please feel free to reach out to us with any questions. Thanks very much.